In this video, you'll hear high-scoring PTE speaking model answers for every task type. Read aloud, repeat sentence, describe image, retell lecture, and answer short question. These responses are designed to help you improve pronunciation, oral fluency, content structure, and pacing. The core performance areas that impact PTE speaking scores. Use this as a repeat after me practice session. Pause, copy the rhythm, then re-record yourself. Task 1. Read aloud. To get high scores in PTE reading, you need to pace your reading so that it is slightly slower than a normal conversation and has clear consonants and steady rhythm. For example, don't read the paragraph presented to like this.
Public health campaigns are most effective when they are consistent, evidence-based, and culturally appropriate. Clear messaging can reduce misinformation and encourage healthier choices across communities.
Instead, read like this.
Public health campaigns are most effective when they are consistent, evidence-based, and culturally appropriate. Clear messaging can reduce misinformation and encourage healthier choices across communities.
Another example. Don't read like this.
Technology has expanded access to education, but it has also created new challenges. Digital inequality can limit opportunities for students who lack reliable devices and internet connections.
Instead, emphasize contrast words. But, also, limit. Avoid rushing reliable devices. Like this.
Technology has expanded access to education, but it has also created new challenges. Digital inequality can limit opportunities for students who lack reliable devices and internet connections.
Our third example. Don't read like this.
In clinical environments, communication is a safety tool. Patients are more likely to follow treatment plans when they understand the reasons behind medical advice.
Instead, stress safety tool and understand the reasons. Keep final sentence confident and complete. Like this.
In clinical environments, communication is a safety tool. Patients are more likely to follow treatment plans when they understand the reasons behind medical advice.
Task 2. Repeat sentence. 6 items. Speak these as the examiner is saying them. Keep them clean, fast, and accurate. Repeat with the same rhythm. The appointment was rescheduled due to staff shortages.
The appointment was rescheduled due to staff shortages.
Please complete the form before you enter the consultation room.
Please complete the form before you enter the consultation room.
Urban transport systems reduce congestion when they are well funded.
Urban transport systems reduce congestion when they are well funded.
The results will be available online within 3 business days.
The results will be available online within 3 business days.
Regular exercise improves mood as well as physical health.
Regular exercise improves mood as well as physical health.
If symptoms worsen, return to the clinic immediately.
If symptoms worsen, return to the clinic immediately.
Task 3. Describe image. 2 items. You are presented with a bar chart titled Weekly Exercise by Age Group, with different age groups and the number of hours they typically exercise. Your task is to interpret the bar chart and explain it. A high band response would be something like this.
The bar chart shows weekly exercise hours across age groups. Overall, exercise decreases as age increases. The 18 to 25 group records the highest level at about 4.5 hours per week, followed by 26 to 35 at just under 4 hours. The 36 to 50 group drops to roughly 3 hours, and the 51 plus group is the lowest at around 2 hours. In summary, younger adults are significantly more active than older adults.
Task 4. Again, you are presented with a graph, but this time it's a line graph titled International Student Enrollments, 2019 to 2024, with various years and approximate number of international student enrollments. A high band response to this talks would sound something like this.
The line graph illustrates international student enrollments from 2019 to 2024. Overall, there's a sharp decline in 2020, followed by a steady recovery and strong growth. Enrollments fall from about 120,000 in 2019 to 90,000 in 2020, then gradually rise to 95,000 in 2021 and 115,000 in 2022. Growth accelerates in 2023 and 2024, reaching approximately 140,000 and 155,000. To conclude, enrollments rebound strongly after 2020 and peak in 2024.
Task 4. Retell lecture, 2 items. You need to listen to an audio and summarize it in your own words. The structure is 35 to 45 seconds. Example. Lecture 1. Today, we're discussing medication adherence. Many patients don't take prescriptions as instructed, not because they don't care, but because of barriers. These include side effects, cost, and confusion about instructions. One practical solution is simplifying regimens, for example, using once-daily dosing when possible. Another is using teach-back, where patients repeat instructions in their own words. Studies show that improved communication increases adherence and reduces hospital readmissions. A high-band response would be something like this.
The lecture focused on medication adherence and why patients may not follow prescriptions. The speaker explained that non-adherence often comes from barriers such as side effects, cost, and unclear instructions, rather than a lack of motivation. 2 solutions were highlighted: simplifying the medication regimen, for instance, choosing once-daily dosing where appropriate, and using a teach-back method so patients confirm understanding in their own words. Overall, the message was that better communication improves adherence and can reduce hospital readmissions.
Another example. The topic is productivity and focus. Many people believe multitasking saves time, but research suggests the opposite. Switching between tasks creates cognitive load and increases mistakes. A better approach is time blocking, where you work on one task for a set period, then take a short break. This method improves accuracy and reduces stress, especially for students preparing for high-stakes exams. A high-band response would be something like this.
The speaker discussed productivity and argued that multitasking is often inefficient. They explained that switching tasks adds cognitive load, leads to more errors, and reduces accuracy. As an alternative, the lecture recommended time blocking, which involves focusing on one task for a fixed period, followed by a short break. In conclusion, time blocking can improve performance and lower stress, particularly for students preparing for important exams.
Task 5. You need to provide short, quick answers to the questions. We'll try 10 examples. Give one short, immediate answer. What do we call a place where medicines are prepared and sold?
A pharmacy.
What is the opposite of increase?
Decrease.
Which season comes after winter?
Spring.
What do we call the document that shows a person's job history?
A resume or CV.
What is the main organ for breathing?
The lungs.
What do we call a person who designs buildings?
An architect.
How many minutes are in an hour?
60.
What do we call a doctor who treats children?
A pediatrician.
What do we call money paid for work?
Salary.
What do we call a test that checks hearing?
A hearing test.
Thank you. That concludes our lesson for today.